each and every week, as always, I try to bring on a guest so that they can either come on and share their testimony or come on and share some information with you so that you can grab a little piece of it and bring it on and carry it on with you in your journey called life. So with that being said, I brought on a very special guest. As always, his name is Adam Robinson, and he owns a pharmacy in Kentucky. So without further ado, here is Adam. Adam, what is up, brother?
Hey, man. How you doing?
Good, man. How about you?
I can't complain. Loving life.
Yeah, there you go, man. How's the weather out there in Kentucky?
It's terrible. It's absolutely. It's pouring down rain and humid and hot, and I just want to stay inside in air conditioning, man. So
there you go.
Yep.
So did the rain just come out of nowhere like it does sometimes, or what?
Yeah, we've had like pop-up showers all day. I thought I was going to get to mow today, and as soon as I get on the lawnmower, it starts pouring down rain. So, it's just bound and determined not to happen. So
yeah.
Right.
So Adam, why don't you go ahead and tell the community who Adam is?
Man, who Adam is? I'm a mystery, man. So Adam Robinson. I was born and raised here in Kentucky. It's my favorite place in the world. I've been all over the place, and when I fly back home, it's awesome. But born and raised here in Kentucky, moved about 10 miles away from my hometown. Went to pharmacy school at the University of Kentucky. Met my
UK.
Yeah, baby. I'm rocking it right here. So
yeah, I see that.
Hopefully we can have sports this year. So
yeah.
Met my wife in high school. We've been together.
Oh, high school sweethearts.
Yeah.
How cute.
Yep. So we've got 3 wonderful kids, and I got a really awesome business and really awesome people to work with, and the community I take care of, and just playing pharmacist every day. It's pretty fun. So
there you go. So you, how long is pharmacy school, I guess?
You can go through, depending on what school you go to, what college. It's usually 6 to 7 years. Took me 8. I decided to spread it out a little bit. Took me 8 years to get through pharmacy school. And now it's typically longer because, like in med school, once you graduate, they kind of want you to go do a residency program, which is usually a year or 2 years after that. So you're looking at anywhere from 6 to 10 years, kind of depending on what you do in undergrad.
Wow.
And then if you want to specialize in certain areas to do that. So, yeah. Yep.
Wow.
It takes a while, but it's worth it, man. I love it.
Heck yeah. That's a lot of work. And, I would assume that you would have to love that job if you're going to serve the community. You know what I mean?
Yeah. I mean, pharmacy is a weird kind of creature. You could do in the pharmacy world, you come out as a pharmacist, there's so many things you can do with that degree. You could be a professor. You could work in nuclear pharmacy, and you could work where you don't even see patients. You can work in insurance. You can work in big pharma. You can do like I do and own your own little independent pharmacy in your hometown and do whatever you want. And so there's so many things you can do. Most people think that we just stand behind a counter and count pills, but that's not even anything close to what we do. But it's fun. Yeah, I definitely love it. So I love serving the community. So
yeah. So when you started school, did you have the vision so when you first started school, did you know that you were going to go to school to be a pharmacist?
Yeah, I was a weird one. I was a nerd in school. My mom was an EMT. And so I can remember when I was a little kid, I'd go on runs with her and help out, and just had this kind of knack for the medical field. My best friend growing up since kindergarten, his dad was the local pharmacist. And so I'd work there and help him. And I just really enjoyed that aspect of what he was doing in the community. And so me and my best friend both went through pharmacy school, and we owned the store together. We worked together. And so I was kind of the weird guy that knew what I wanted to do from like 5th grade. So
nice.
That's kind of what I wanted to do. And I busted my tail and finally made it through and did it. So
boom, way to follow your dreams there, man. Way to stick to it.
Thank you.
All right. So we got a hi here from this lady with the beautiful little girl as her picture from Shannon. I think that's my daughter. I'm pretty sure.
Definitely takes after Shannon, not after you.
Yeah. And then we got a hello you too from Jerry Wald. So so you said that you and your wife were high school sweethearts. So obviously when you started going to school, you guys were together.
Yeah.
Now, did you have children? How many kids do you guys have now?
We have 3. We have a set of twins, and then we had one a couple years after that. So.
And how old are your kids?
The twins are 9, I think. Don't hold me to that. And Annie's 7. So they're going to be 10 and 8 this year.
10 and 8.
Mm-hmm.
10 and 8. So when you were going through school and all that jazz, no kids, right?
No. So when Amanda was a couple years behind me in school. So I went to college. She was still back in the country. And she'd come visit me back and forth. And then she actually went to school up at UK while I was there. And then she got finished before I got done. So she went back home. And we did the whole, breakup thing, and we've been together forever and all that kind of stuff. But it just was meant to be. And I'm glad it worked out that way. But I was always kind of the guy that was like, let me graduate. Let's put this focus here. And then as soon as I graduate, then we'll get married. And it kind of went that pattern. So graduated, we got married, and then we tried for a while to have kids. We had some infertility issues, and that was a real struggle for us. And but after a couple of years, we had twins. So, but yeah, that's how it went down.
Nice.
Yeah.
Now, so you got your degree, and was it like, hey, I'm going to open up my pharmacy? Was that like your dream? Like, I'm going to open up my own pharmacy? Or
yeah, it was. My dog's trying to get in here and get on camera. Knowing that where I had worked at before, I'd always worked in the independent field. So in the retail pharmacy setting, there's 2 settings. There's the chain, your Walgreens, CVS, Rite Aid. And then there's the independents, the, small mom and pop stores that own their own place. And that's what I grew up working with. That's kind of where I cut my teeth. And for me, there were so many advantages to that. And that was my dream. And so I was lucky enough that my best friend graduated 2 years ahead of me. He came back and worked at his father's store. And then at the time I graduated, I mean, God is amazing. But at the time I graduated, a guy in our hometown decided to retire and sell his pharmacy. So we ended up buying that store as soon as I graduated, and I came right out and took over that store and been there ever since. So
nice.
Yeah. So it just, timing is crazy. So
yeah, timing is everything. Isn't that what they say?
Yep.
So how long ago, or I should say, how long have you owned the pharmacy that you have now?
I graduated in 2007. So what are we looking at? 13. It'd be 13 years in October.
Nice. Congratulations.
Yeah.
So, so being that, you have you're talking about, you have your chains, and then you have your independent pharmacies. I was kind of thinking about this the other day, so say for instance, I guess I probably shouldn't use a name, but I use a rather large chain, right? And I can't go in there and be like, I only have $10 for this prescription and it's $13. They're going to be like, sorry, I can't do nothing for you.
Right.
So being an independent pharmacy, are you able to like do something with that? Because
yeah, well, all right. So let's say legally from the insurance perspective, I gotta be cautious now, but yeah, that's why I love the independent world. And I have great friends that work in retail in the big chains, and they love it, and they get to play pharmacist. And I say that because as a pharmacist, and really anybody in the medical field and anywhere else, you want to practice at the top of your license and take advantage of the things that you can do. And so a lot of my friends, they do that in the chain setting. Where I come in with the independent setting is a lot of the business side. So there's so many more opportunities. If I decide I want to start a new program, then boom, I just start a new program versus they have to kind of go through corporate and
Right.
all that stuff. So yeah, we have charge accounts, and the old school way pharmacy used to work was that there was a lot of bartering. There was a lot of charge accounts and a lot of things like that, because most of your independent places were in very rural communities where there was the economy wasn't as great, and so they were allowed to do that. But the flip side of that was there wasn't a lot of insurance. Probably back in the 80s, early 90s is when you really started seeing people have prescription insurance. And so you could do anything you wanted to, hey, I'll charge you, come pay once a month, or hey, I'll pay for the $3 this time and catch me on the next side, that kind of thing. And that's your small community, everybody. And I do that quite often. And I'm not ashamed of it. But then you get into the whole insurance side, you have to collect copays, you can't do that kind of stuff. So it's a lot more difficult now to do, which I don't like. I like to take care of my people. But yeah, that's what we can do is the independent side as far as the business, how that works.
Right.
Yeah.
Right.
Yeah.
Now, so I'm in a lot of groups like on Facebook, like stroke groups, depression groups and whatnot. So I have this question for you, being that you are a pharmacist, and I kind of want your, don't give me the what you think the politically correct answer should be, because I
always say I'm the most unprofessional professional there is. So I'm going to give you the real answer, Mark. I will give you the real answer.
All right. So let's say, for instance, a doctor. We're going to use two different, because I do know that certain medications affect differently. Okay. So we're going to use two different medications.
Okay.
So let's say you're on 3 different seizure medications, right? And a doctor prescribes you a different seizure medication. And that seizure, you've been taking the seizure medication for a month. The medication makes you feel weird or whatever, makes you feel off. So you take it upon yourself to take yourself off that medication. Right? So being a pharmacist, studying medicine and all that jazz, what is your take on that for seizures?
For seizures, seizures is a tricky medication field. Okay, so we're talking about the brain, and the brain is so complex, and it likes routine.
Right.
When you jack around with the routine of your brain, that's where you get you're feeling weird, right? So you're messing with all these chemicals. And this is not an uncommon question, by the way. I get this a lot. And it's a risk versus benefit, right? So I have people that come in that have seizures daily. I have people that come in that haven't had a seizure in 20 years, right? So yeah, they're switching them because they're adding a new med, or they're switching them, or they're doing whatever. First thing is, don't ever just take it upon yourself. At least ask some kind of professional. It's very difficult nowadays to get a hold of a physician, to get a hold of your prescriber. You have to leave a message, you have to do all this stuff, and people don't like to feel bad. So that's where you get what you're talking about. They just take themselves off. The risk versus benefit. If there's somebody who's really low threshold on the seizure, so they're very likely to have it, that's not a good thing. That is not a good thing at all. If there's somebody who's like, hey, we're just trying this out, but the other meds still have kept me going, then I can see that. And a month is probably okay, right? With the brain, I like to say you got to give it a good 6 weeks for it to really, to whether whether or not you can tolerate it or it's going to work. And then after that 6 weeks, you really kind of need to wean yourself off of it a little bit, because your brain's like, okay, I'm finally back to where I need to be. And then here you are jacking around the medicine all again. And it's starting to and you're just going to feel just as crappy as you did going off of it as you did going on it. So
Okay.
I don't know if that really answers what you're talking about.
No.
What I want to say in that is, call your pharmacist, call your physician, right? And just ask. And where I actually see this question coming from is, a lot of people, they don't feel confident enough to speak, or they don't feel like they can speak to their pharmacist or their physician on these things. And I don't know why. Like, their surveys have been out for 100 years. Pharmacists, nurses are the most trusted profession, but people don't feel like they can usually ask a lot of questions to us, and that's why we're there.
Yeah.
So that's the one thing I can take away from that question, is just call your pharmacist and ask them, hey, what's up? What do I need to do?
No.
And go from there.
Yeah, because one of the things that I found alarming. Now, one of the things that I found alarming, was the fact, I think maybe the month into the medication is probably kind of like what maybe threw off that question a little bit, because you did jump in and say 6 weeks is when your brain adapts.
Yeah.
Because that's kind of like what I was getting at. Because one of the things that I was throwing me off when people would say that is that they just, cold turkeyed it, and I was like, I don't think you're really supposed to do that with that type of medication. You know what I mean?
You probably should. No, you probably shouldn't.
Yeah. And the same thing would go with like antidepressants, or is that like a different chemical?
Well, let me tell you why this is such a big deal. So we have this thing called a therapeutic window. Have you heard of a therapeutic window before?
No.
So medications, specifically seizure medications, have what we call a very narrow therapeutic window. So think of, you got your window here, and I give you an antibiotic like amoxicillin. Okay, you got some kind of ear infection or whatever, and I give you antibiotic. That antibiotic is going to work in a very large window. It's going to work from 200 milligrams to 1,000 milligrams. It's going to work, right? Seizure medications work in a very tight window. So here I have seizures. Here I'm toxic on the medicine. And right inside this little bit of area right here is where the medicine works. So, okay, you've probably seen it. At 500 milligrams, it's just not really working. 750, I feel like crap. So maybe they give you 1 and then 2 the next day or something, and boom, you hit that sweet spot. No seizures, no adverse reactions, none of that kind of thing, right? So when people start playing around with their medicine, and this can even go into, which is another topic, is switching from brand to generic, switching different companies of generics. That threshold on that window is so tiny that even the tiniest change in that can mess you up. And I do have a patient who is a seizure patient, and he has to take a very specific brand. And to get into that, the reason why is the FDA says that a generic is equivalent to the name brand if it's plus or minus 5%. So if you take a 500 milligram tablet, plus or minus 5%, you're getting down in the 400s, or you're getting in the 5 whatevers. And he is that tiny of a threshold before it throws him in having seizures. So that's where, so antidepressants have a bigger threshold. Okay. So you can go off of that. You'll probably feel crappy for a day or two. No big deal, right? Seizure medications, you start messing around with it, miss a dose, miss a couple doses, your window is so tiny, boom, you have a seizure.
Yeah.
So seizures, thyroid medicines are like that. So if you know anybody that takes thyroid medication, there's like 20 different strengths, because the window is so tiny to get it right on where it needs to be. So hopefully that answers a little bit of that question.
100%.
Yeah.
Yeah. I noticed too, because for those that don't know, I take a crap ton of seizure medications. And so if I take my medicine at 11 a.m., and pretty much 11 p.m.
Mhm.
So I noticed that if I don't take them pretty close to the same time every day, that I will feel like kind of off. You know what I mean?
Yeah,
So say for instance,
your brain's like craving it. Like, hey man, what's going on? Where's it at? I
yeah,
need it, right? And yeah, so that's exactly what it is.
exactly. Like
Mhm.
if I feel like kind of off, I'll be like, ah, shoot, I didn't take my medicine today. You know what I mean?
Well,
It's,
I take a antidepressant medicine, and I can tell it about. I take it every morning, and if about lunchtime, I start like, man, I just feel weird. Oh, forgot to take my medicine this morning, right? And so, yeah, your brain's not dumb; it knows what's up. So,
no,
yeah,
yeah, for sure.
yeah.
Now, where what's the next step for you and your pharmacy business?
That's a really good question that I'm working on right now. So, the business model for pharmacy for a long time is fill as many prescriptions as you can. As a pharmacist, that's not really what I want to do because I want to spend as much time as possible with my patients. And so there's a fine line there. So now we fill as many prescriptions as we can, and we fill a lot where I'm at. And I'm trying to figure out how to get back into more one-on-one with my patients. Plus, the market on prescription, the money that we can make off prescriptions has dramatically decreased. So I'm trying to find a different business model. And what we're coming up with, it's called service-based pharmacy, is kind of the umbrella that it's under. And it's different services that we can offer as a pharmacy other than just filling prescriptions. So the state of Kentucky is a very progressive state when it comes to pharmacy. So they allow us to do things. They're really good at opening up some laws for us. So this past year, we got into flu and strep testing. So instead of going to your physician's office, you can actually just walk in the pharmacy. We can swab you. If you're positive, we can dispense the medication. So we have that. Immunizations is real big, is what we do. We're looking into doing some more council-based ideas like smoking cessation. We're looking at that. So that's really where our next steps are probably going to go in 2021. We're trying to get everything in line now and just really start offering these services, whether it's weight loss, smoking, again, immunizations, flu and strep. I just got a protocol signed by the Board of Pharmacy to offer nutritional supplements. So patient comes in, they want a multivitamin, we can help them find one that's covered by their insurance and then talk to them about it. And then we can dispense it right there without them actually having to go to the physician's office to get a prescription. So
Wow.
Trying to go that way. And of course, we have the old school stuff, compounding, which is a really big market. If you can get it.
What's that?
So compounding is old school pharmacy. So we're talking like 1800s. That's where it started. You walk in and I just start taking some concoction and mixing it up and I give you what it is. But really what it is a customized medication. So example, seizure medication. Patient can't take 500 milligrams because it doesn't work and they can't take 750. So the doctor says, you know what? They need 620 milligrams. Well, that's not readily available. So I would actually have to make that for you in different forms. I can do suspension, we can do capsules, we can do whatever you need, suppository. But we do a lot of suppositories, surprisingly. So it's a custom medication for the patient, however they need it. Pediatrics, we see it a lot with pediatrics, especially kids that have heart issues. They don't make a beta blocker for your heart that's not a tablet, so we have to make it into a liquid or something like that. So yeah,
like kind of like a chewable or something.
Mm-hmm. Yeah, we can do chewables. I do dog stuff. We do a lot of vet compounding, hormone replacement compounding. So the sky's the limit when it comes to the compound world. So we can really make anything you need. And so we dabble in that at my pharmacy. The market's not real strong for that where I live, very rural area. You have to have some physicians that back you up and they really like it. And But in some bigger areas, compounding pharmacies are huge. So
It sounds like fun.
oh, I love it. I mean, it's a problem. They come in, they say, "Hey, I've got this patient that has this issue, and I don't know how to solve it," and they just hand it to me, and I solve that problem, and then make sure the patient, a lot of it is how do you even get the patient to take it. Um, Kids, and there's adults that can't swallow, adults that are on feeding tubes and G tubes, and how do you do that? So there's a lot to it, and so we try to figure it out. So solve the problem.
Very cool.
Yep.
Adam, the problem solver.
Yep, that's what I do, man.
There you go. There you go. Now, Adam, do you have any final words for your for the community, whether it be the stroke community, or do you have any final words for them?
I see a lot of patients that come in, my patients, and I know a lot of people like that are like this in the community. In what I was talking earlier is you have to be prepared to take care of yourself. And a lot of people are scared to ask questions, which thank God that you have this show where they can get on here and ask questions. They can watch this and learn things. People are scared to ask questions. People think that doctors, pharmacists, nurses, whoever, just want their money, right? And or they're scared to leave their physician they've been with since they were a baby. The pharmacy, you have to ask questions. Be conscientious of your health. If something's wrong, go try to figure out what it is, right?
There you go.
And figure out, don't take no for an answer. Now, don't be a hypochondriac, but, don't take no for an answer. And we see that a lot. All the physicians I work with are fantastic, but they're human, just like I'm human. And you get overwhelmed, and sometimes you might miss something and whatever. And so people just say, well, he didn't think it was a big deal, or they didn't think it was a big deal, or the pharmacist didn't talk to me about this. So, pick up the phone and make a phone call. Come back into the store. Go back into the office. And then when it comes to stroke, stroke is such a big deal, and so much of it can be solved with diet, exercise, just healthy living. Smoking is a huge thing. Kentucky, I live in Kentucky, and we're the #1 smoking state. That's why I really want to focus on the stop smoking. It's like 1 in 3 people here smoke. I think it's something like that. And that's such a huge issue when it comes to stroke, and people don't understand that. So, a lot of people sit around and they want people to take care of them or tell them what to do, but you got to stand up and you got to try to figure it out yourself, and use what you can. There's pharmacists out there that are just dying to talk to you. As a pharmacist, we love to talk to people. We wouldn't be in this job if we didn't do it. And come. You might have to wait 10 minutes on us to get done what we're doing. We will go talk to you. So, so go talk to your pharmacist. Go talk to your physicians. Be proactive about your health, and then don't take no for an answer. So,
I love it.
Yep.
Because the main thing that I wanted to talk to you about, which we did discuss, was, not to pull yourself off your medication.
Yeah.
And so that's my final thoughts for everyone, is go. Now that you can go speak to your pharmacist. You don't have to just speak to your doctor.
Right.
Actually go to the pharmacy and speak to your pharmacist and say, hey, this is what's going on. What should I do? And then from there, they'll tell you, hey, go talk to your doctor, or hey, you can do this or do that. So
yeah, exactly. And there's not always the right answer. And that's what we are good. The problem solving aspect, pharmacists are problem solvers, and we're going to give you options and ideas, and you have to determine what you want to do. but we're going to help you down the right path. And that's what we'll do. So,
Right on, brother. Hey, I appreciate you, Adam.
Thank you, sir.
And I end all my shows with a prayer.
Sure.
You got this one, brother?
I do, man. I do.
All right, let's do it, Hewitt.
All right, man. Heavenly Father, I just want to thank you so much for Mark. I want to thank you for what he is doing for the community, for his community, for the stroke community, just gathering information, helping people make wise decisions, wise choices for the betterment of their health. Lord, just continue to bless him, continue to bless all those that watch this show, all those that need you, all those that don't know you yet, that maybe they can watch this and we can be a light for them to ask the question who you are. Father, just watch over all of us. Keep us all safe. It's in your wonderful name we pray. Amen.
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 I appreciate you, Adam.
Amen. Anytime.
Thank you again for coming on and sharing all your wisdom. I appreciate it, brother.
All right, man. Anytime you need me.
All right, brother.
Take care.
You too.